Love to Hate, the podcast that asks the question, what do you love to hate?
You are a smelly pirate hooker. And I hate your ass face!
Do you love it?
No!
Do you hate it?
Oh, yes! Yes! You stupid, ignorant son of a bitch, dumb bastard! I'm charting your general direction!
No more foreplay.
Take two. I'm Philip Pullman.
I'm Brandon Luna.
And this is Love to Hate.
Yay!
Yay! So, what are we going to talk about this week, Brandon?
HealthCare.
HealthCare. I'm all about healthcare. I think people should stay healthy.
Yeah?
Yes.
I'm all
Take
about
care of yourself, and there you go. I'm all for it.
Healthcare, taking a shit and just being done with it. I'm sick of healthcare.
So, but not staying healthy. You're still
No, staying healthy is great. I just think healthcare is out of control.
It is. There's a lot of variables to it that it's. Oh man, where do you even begin with this? So you and I have talked. It was funny when I was in broadcasting. They always said, "Never talk about conversations you had off the air because it leaves the listener out." And it's like, no, I think it's kind of fun because it makes it feel like it's personal. Yeah. So that said, you and I were talking beforehand. I'm a guy who uses a lot of insurance. I have a genetic blood disorder, and so it requires me to go get phlebotomies. Vampire, yeah. They used to treat it with leeches. Basically, it's like donating a pint of blood, except mine goes in the trash, and that's to lower iron levels. This is something I have to do every 6 to 8 weeks.
Wow.
That runs about $860.
Ouch.
And that's with insurance. That's the cost. So now, for reasons I won't go into till a later podcast, maybe December or June timeframe, I'm going to be shopping. I'm going to be entering the marketplace for my own insurance. And my healthcare provider, the one who does my phlebotomies and treats this, does not use most of the insurance companies in the open marketplace.
Yikes.
So guys like Bob's House of Insurance or, Todd's Discount Insurance, they don't use that. And the providers they do use, Aetna, Humana, Blue Cross Blue Shield, any of those have now backed out of the Texas market.
Nice.
So now I'm in a position of how am I going to find insurance because this is something I have to have treated. I could go to the blood bank and just when I feel bad, donate a pint of blood, but then I don't get the lab results and we're not monitoring all of that.
Yeah.
So I'm in a scary position of what is this going to cost?
I have a solution for you.
What's that?
Move to Canada.
Ooh. Alert listeners will know that I have issues with Canada.
That's why I said that.
Yeah, I had a hunch. It's some people really praise it. They say, the healthcare system there is great. I have a friend who lives in the UK, and she says the healthcare system not so great because she needed surgery, and she was going to have to wait 1.5 years if she went through the system. But doing it herself, she was able to get the treatment she needed sooner. So I don't know. I haven't studied enough on it. I know I'm not going to move to Canada. Couldn't afford cigars there.
Yeah,
but,
exactly.
What? So what is the answer to this? I mean, we've had people laud the healthcare bill, commonly known in layman's terms as Obamacare, this apparently 1,000-page document that nobody actually read, which I have a feeling is like most government legislation, but it doesn't seem to have helped. It doesn't seem to have opened things up. I know it says you can now not be denied because you have a pre-existing condition, which would be me, but how do you afford the premiums?
Yeah. Well, the problem with Obamacare and what it did was that doctors don't like it. So a lot of doctors have stopped partaking in these systems so that they don't have to take it in the ass for what Obamacare does to them.
Which is?
Well, so Obamacare pays them a lot less than insurance companies do. So they're taking a hit on what they would normally make through the insurance companies by working with Obamacare. So a lot of them have backed out, either moved to some Canada or whatever, to not be involved in that system. Now, you would think you're a doctor, you're making a shit ton of money anyway, but it is about the money, and they have to support, especially if you've got a private, care, and you've got employees to pay and all this other stuff.
Malpractice insurance is huge.
Malpractice insurance as well, exactly. So, they're taking it on the nose, and they don't like that. So Obamacare has kind of muddled the works for them and caused a lot of them to kind of leave that system or not be part of it.
It's easy to really get into a socialist versus capitalist argument on this point.
Oh, yeah, for sure.
Because you could argue that doctors should do this for the love of the patient and that it's all about serving humanity.
Correct, but they've got to also pay to fix their Porsche and their really nice house and everything else that goes along with it. They've got a certain level of income that they expect, a certain cost of living, a certain lifestyle that if they were all doing Obamacare, they wouldn't be able to do anymore. So
it's not that people get into healthcare anymore, say medicine, to necessarily help, but it's a good living.
Yeah, definitely a good living, yeah. Doctors, lawyers, that's what you always hear people wanting to be. Like, I want my kid to be a doctor, I want my kid to be a lawyer, because you're making a crap ton of money doing either of those jobs.
I would argue I would not want my kid to be either.
Yeah.
How many doctors and lawyers do you think actually listen?
Probably not a lot.
Okay. I was going to say, because in my experience as a man who used to spend a lot of time on bar stools or in social environments, neither of those seem like people I would want my little girl to grow up and marry. Yeah, a lot of ego there.
Yeah, definitely a lot of
ego. Just not somebody I would think of as the best provider.
Doctor,
not outside
lawyer,
of the
CEO. Those guys.
Yeah. From a monetary standpoint, she'd be fine, but from that emotional, spiritual aspect, it seems like she would be lacking.
They're pretty vacant, yeah. In
they
that
are.
Respect, yeah.
And
not all of them are, mind you.
No,
We're not saying
honestly,
statement.
that's been one of the hardest things is when I got diagnosed was finding doctors who really gave a damn.
Yeah.
And made me feel like they gave a damn, and not just that Dr. House version of we're going to do this and you'll be fine. It's like, man, I got something here that I'm going to live with the rest of my life. Granted, it could be a lot of worse things that aren't treatable. However, I don't want to be made to feel like I'm a nuisance to them. I want somebody who's going to talk with me about this. How are you feeling? What have you noticed that's new? Somebody who takes an actual interest. And right now, I'm fortunate to have 2 doctors like that. So it scares me, the idea of, man, I'm going to have to go to the new doctor who just got out of med school, and he's got to pay that lease on his Porsche.
Right.
I want to find the guy who genuinely has my best interest at heart.
So I think it's all connected, right? And I think where a lot of the issues come up is insurance is out of hand. I mean, let's just say it. How much we pay for insurance, how much insurance charges for things, it's all connected. So doctors can charge insurance companies exponentially more for drugs because they know they're going to get the money, and they've got to take their piece. The doctor's got to take their piece. We take it on the ass for that. So it's all connected. So insurance, which I have a big problem with, I've always seen as basically legalized mafia. Because if you think about it, the concept of insurance is if you give me money now, I'm going to protect you later when you need it. Which is basically what the mafia did. It's like, hey, you pay me a little protection money, we'll take care of you, don't have to worry about these things, break-in and stuff, and guys coming in your shop. It's a little, you're not going to pay insurance and then have some guy come and break in your house and steal your medicine. It's not that bad, but it's still that same kind of concept as you're paying
You're
now.
gambling.
You're gambling. You're paying now for the ability to have coverage should you need it.
Yeah, when it happens. It's the same with auto insurance.
Yeah.
Maybe you never have a wreck, but it's still there just in case shit happens.
And I talked to my wife about this 10 years ago. It's like, why isn't there an insurance company, an auto insurance company, that basically takes your money and says, okay, you're paying this much every month. Eventually you'll be vested where you have enough money that we're going to start putting money aside for you so that something happens, we can take that money that you vested. We're going to make money on it. We're going to make interest on it and whatever, and use that to pay your copay or your deductible, as it was, and then you can use our service. And there's a couple insurance companies on the car side that are finally starting to do that. They have forgiveness or whatever they call it now, where you have a certain, if you stay
Aren't
with
your
us,
rates higher though?
Yeah, they are, but it's all connected. I mean,
Dennis Haysbert was the president on 24, and I really like him, so I feel like I can trust him.
Yeah. So, I mean, it's all connected, and I think insurance charges way too much. I mean, with a family of 4, I pay for my wife pays for the family in the $1,600 a month range for insurance, and that's just for the 3 of them.
Pre-tax?
Pre-tax, yeah. I pay $100 something a month for myself. So you're looking at almost $1,800 a month for insurance should something happen.
Right.
And my daughter's type 1 diabetic, so we do have monthly expenses. But lo and behold, every month, half that stuff isn't covered. So what am I paying you for, basically? It's
Right.
like I'm paying all this money
because
out.
they're changing the coverages, and they're not always the best at relating to you when your coverage has changed. Because unlike you have an open enrollment, when you're now able to sign up and opt to change your coverages, they can change them at any time just because they want to.
Yep.
Or because the stockholders are not getting the amount of dividends they need, so they're going to change what they offer as far as coverage. One of the medicines I take, I perpetually have to get that approved at the beginning of the year during a new coverage period.
Correct.
Because it's not something they normally cover. So my doctor has to write a letter saying, no, this is the medication he needs. And this is with the same insurance company. And after having sent letters from the doctor previously saying, he's tried this, it doesn't work, tried that one too. All the things that you want him to use in lieu of this do not work. This is the only one. Please let him use it. Yeah, you got to try him again. Maybe this time we'll get lucky and we won't have to pay for this one. It's like, look, I'm paying it, so why not?
Yeah.
Let me use it. I'm paying the deductible or the copay on it. So give me the medicine that I need.
Yeah, we've seen that on my daughter's side too with the type 1 diabetes. So she has a certain type of medicine that she uses every month. She goes, fills the order. We go pick it up. Hasn't been a problem. All of a sudden we go to pick it up and that's not covered. What do you mean it's not covered? It's been covered for the past 7 months. Why is it not covered now? Well, the insurance changed and they want you to use this now. It's like, well, okay, that sounds great, but by using this other brand of medicine, she now has to go back to her doctor, which is going to cost us more money,
right,
to check to see, okay, well, how do we dose for this now because it's a different thing? Well, you really need to use this. She's better on this. We tried both. This is really the one she needs. Well, it's not covered. Well, yeah. So I guess you need to pay for that out of pocket. Like, really? Like, what the hell am I paying?
Can't they send a letter to the insurance saying, no, you...
Yeah, we figured it out. But
I'm trying to remember the name of it. Basically, the doctor sends it and says, hey, they have to have this. And then they're like, okay, well, we'll charge you more for it. But
exactly, yeah. So now we're paying more of a deductible or more of a copay for this particular one, which is the one that she has to have. And it's going to continue to grow. I mean, it's going to happen over and over again. So
because insurance companies, they may say they have doctors on staff, but their job is not to sit there and take care of the patient. It's to save a couple of bucks.
Exactly, yeah.
And that to me, again... God, sometimes, it'd be great if socialism was actually a thing that could work. I know it's not.
Yeah.
But, to me, and this is probably my inner hippie coming out, stuff like that should be free.
Yeah, definitely.
You should not have somebody go, I'm ill, I cannot afford to be taken care of. That should be free. You need the drugs to take care of it. It's free. All of this is just free because we're going to take care of people. It doesn't work. But you should never have that or starving people.
Right.
That's just something that those are things that, it's not your right. There's nothing in the Constitution that says we guarantee 3 squares a day. But it's just one of those things that as human beings, it's the right thing to do. And I know that's not possible. And I'm not preaching the gospel of socialism because I know it doesn't work. But it's one of those things where that would be something where it would be great if everybody could just have access to that. And it wasn't this system, again, built on money because you have these things that people do, religion, things like that, where this is something you should have access to because you need it. Or in religion's case, because you're seeking it, and there shouldn't be a price tag.
Yeah. Or you should be able to have a cap where you say, this is the most I'm going to spend. I've got a disease that I've got to pay for the rest of my life.
Yeah.
And this is the price I'm going to pay for these drugs forever.
Sure.
Figure it out. I'm going to pay this deductible, and this is my cost. And that's it. It shouldn't
can I get on the lifetime plan?
A seesaw effect.
No, it shouldn't.
That we have
because then how do people... how do people budget for that? And you can have, relatively speaking, in the insurance world, I'm young. Mm-hmm. I'm only 47, so I'm, now I'm just now starting to tap into over the last probably 10 years using a lot of insurance. But with your daughter, she's younger. This is something she's got a lifetime ahead of her that she's going to need it.
And I told her, like, at this point, you need to get out of college, and get a job in the government somewhere, because then your insurance is covered, it's paid for, and you can live a normal life. Because if you have a regular job, a 9 to 5, or somewhere, doing graphic design at some little hippie company, your insurance is going to fluctuate. Her cost for her to live is basically a mortgage every month.
Yeah, because it doesn't matter if you have a good job or not, because you've got this huge insurance bill that you're trying to pay.
Mm-hmm. And you're constantly fighting over what your bill is going to be every month, because it changes. Because they change what they'll approve to use. And
it does. It puts you in a position of, okay, do I take this job just for the benefits? Yeah. And I'm kind of at that position. I love what I do. I finally found something I'm hesitant to say, but I think I'm pretty good at and I enjoy, but no benefits. But I knew that going in. Yeah. There was my situation was different when I started, but this is something I'm going to have to look at. And do you then go take a job you don't want, where you have to wear polo shirts and khakis and those funky looking casual dress shoes, just so you can get benefits to live?
Yeah.
And honestly, that's a scary position for me to be in, because I really don't look forward to that. I got out of it, and for the first time, I'm probably happy in what I do.
Yeah.
But now it's like, okay, is it that old thing about, well, you got to grow up? You can't always work for, the hippie art designer and wear your earrings. You've got to go take care of this stuff. So, that's kind of the crossroads I'm at, and I know I'm not the only person. And God forbid, some of these people who have been on this for a long time, in their 70s, 80s, and now they're starting to dick with their benefits. And these people, have been on medications for years, and they're on a fixed income, and they're not able to just run out and go to the local whatever business and throw their degree down and go, okay, I'll work here in human resources and get benefits. They don't have those skill sets. Nobody's looking to hire a 75-year-old in IT or some of those positions. What do?
Yeah. And I never understood why something is prescription for a certain amount of time, and then now it's OTC. Where's the catalyst? Is it that they had to make their money back on the research and design for all this for so long, and now once we've made our money, the rest is gravy, and now it's over the counter?
Or is it the FDA?
Yeah. What causes that? What changes that?
Suddenly, you couldn't take this, but maybe it's the copyright expires on it, or the trademark.
Yeah.
And now all of a sudden you can do it as a generic. Whatever the company is that has the EpiPens, mm-hmm. They just jacked the price up to $500. And parents were having issues with it because, an EpiPen expires, and, hopefully you never have to use it, but you got to have a fresh one.
Correct.
And they were saying, hey, now all of a sudden, why are they so much higher? But now the same company that raised the price on the EpiPen is offering the generic.
Right, yeah.
Yeah, it's like, come on, really? Why do you have to do that with people? Are you making your money back? First of all, why are there investors? Maybe that's the thing. Why do you have stockholders in an insurance company? Is that just to get your backers so you can afford to make the payouts? Because really, the idea is they've got to make their money.
Yeah, correct. And when you go back in time here a little bit to
I need health insurance for my car.
Right, yeah. When my parents were, young adults and raising a child, you didn't have insurance. I mean, if you had insurance, it was because of a job. And what did you do? You saved money up. So if something happened, you had money for it.
Sure.
So, and talking about what you just had happen to you, you got a list of stuff that you have to buy. Mm-hmm. And you went to the doctor and said, hey, what if I don't have insurance? And what did they say?
It'd be half.
So where's the half? Who's getting
right.
the half? Why is it that I can go to a doctor with cash and negotiate down to a reasonable level my care, but I have to pay $12,000, $13,000 a year to an insurance company, which I'm never going to see that back.
No.
Ever. So what's the solution? Do we just back out of insurance?
Do you put caps on medicine? Do you say you can't, you can only have a markup of so much?
It should be nice. It would be great.
But then you're going to get the fight. Well, then crap. I'm not going to make any more medicine for you because I'm not going to get enough money out of it. How much money did Jonas Salt make? Remind me of that. How much did he charge for the polio vaccination?
Yeah, right.
Or vaccine rather. Yeah, exactly. The days of doing things for humanity are done. Everybody wants a buck. It's like Heath Ledger said in Dark Knight. If you're good at something, never do it for free.
Yeah.
And that's how a lot of these companies are. And you've probably heard the conspiracy theory about cancer. There's a lot of people out there going, oh, there's cures for cancer, but think of all the money they'd lose if they cured it.
Yep.
And honestly, I'm not a conspiracy theory guy, but let's say there is a cure for cancer. That argument holds water because people would lose a shit ton of money if all of a sudden nobody had cancer.
Correct. Yep. And there'd be a lot more people on this planet that the government would have to pay to keep alive.
So we can only pray the future becomes like Gene Roddenberry's vision and
everything's covered. Yeah.
Yeah.
Is that socialist? I mean, was that what Roddenberry basically
There was a lot of socialism in there, yeah, but it was the idea of we've now devoted ourselves to higher causes.
Yeah.
And money no longer became the end-all be-all because everybody had access to everything.
Yeah.
And if you think about it, part of the reason socialism doesn't work is because for the guy who's going to go out and bust his butt, what incentive is there if he gets the same portion as the guy who does nothing?
Yeah.
And now you have a guy who can do nothing and still make the same.
It's the constant struggle between the haves and the have-nots.
It
People
is.
who are out there really busting their ass, making the living to live at a certain level because they want to be comfortable there, versus the guy who does nothing and the government pays, for him to live. So we're just in an awful spot where there really is no good resolution other than putting caps on medicine, on the cost of medicine. And I think they've tried to do that with Obamacare. But even then, my mother, who is an elderly woman who's on a fixed income, can't afford Obamacare. It's substantially more than if I was just to put her on my insurance.
Sure.
My insurance would go up another couple $100 a month, but it's cheaper than her paying $500, $600 for Obamacare every month.
It's kind of Dr. Seuss. What a great prophet. The story of the Sneetches. Some had stars on their bellies, some didn't. Mm-hmm. It's kind of that thing. You could give everybody $1 million house and a brand new Mercedes in the driveway, and yet people out there are still going to find a way to make themselves appear to be better than the guy next door.
Oh yeah, totally.
It's unfortunate, but because we measure our success by those things. Mm-hmm. And perhaps, I know I'm going on a rabbit trail, perhaps it's because those things are quote unquote measurable. We can see their wealth or their supposed wealth, because here in Collin County and in Frisco, most of it's on credit cards and people are living month to month and paycheck to paycheck. But you can visualize that wealth, so I can look at this guy and go, look at how he's dressed. Look at what he drives. He is a success. And there's no way to look at a person and go, wow, they're a good person. They're a real mensch. They have a good heart, good mind. They're a successful human being because they're a good person, but they don't drive that type of car. So you can't tell what type of success or what type of person they are. So we base it all on the outside.
Yeah. Going back to last week's episode, looking at reality TV and the people that we idolize, it's the real wives of Atlanta and the real wives of California and the real wives of whatever.
Yeah.
People idolize these people because they're living at that level that they want to live at, and they're going to do whatever they can to get there, whether, damn it all, if it's on credit cards and, you're living paycheck to paycheck. But we strive for that because of what the media presents to us and what people around us present to us.
And if you look at those people, would you want to be friends with any of them?
No, they're awful people.
They are. And the idea of them saying, well, it's all just, that's how we portray it on TV. But you're okay with being portrayed like that.
Yeah.
I would not, like you, I would not associate with any of those people, nor do I want any of those things. And that's why I keep telling myself, I'm going to go buy a lottery ticket. But you hear so many people going broke after winning the lottery, and I really don't, and maybe I'm naive, I don't think I would go broke after winning the lottery. And I think part of the reason is I don't want a Rolex. I'm not sitting here right now going, man, if I had money, oh man, I wish I could afford a Rolex. Or
you can tell.
Yeah, thank you.
I'm saying you can tell the type of person that's going to go broke if they win the lottery by having that conversation. And you have it all over in cigar shops everywhere. That conversation happens. Anytime the lottery gets out of control, oh man, I'd go out and I'd get $1 million home and have a Porsche and a Ferrari. And I was like, well, you'd be broke in 2 years.
Yeah, and I don't have any desire for those things now.
No,
I would like a nice paid off mid-sized car that is reliable. That's all I want. I don't need bells and whistles. I don't want a huge house, but I'd like something nice that's going to last and that I can pay off. But all the opulence, none of that appeals to me.
Yeah.
And yet I know there's a lot of people who that does appeal to. And like you said, in cigar shops. But obviously I love cigar shops, but there's a lot of dick measuring that takes place on a daily basis.
Yeah, definitely.
A lot of toppers.
Yeah.
And a lot of people who have opinions on this very subject that we are talking about, both pro and con.
Do you know how much medical sales people make?
Tell me.
They make a shit ton of money. I talked to someone in Vegas, home of the fake people, going back to an ex-episode or previous episode. And
it's all facade.
There was a lady, I was sitting there drinking, and we were talking, and she's like, oh, I'm in medical sales. I'm like, oh, I'm in cigar sales. She's like, it's like two polar opposites. You kill them, I save them. I'm like, oh, come on now. But, that conversation happened. I'm like, just, curious. I always imagined that you guys, really rake it in. She's like, just give me a ballpark. She's like, oh, I clear $500,000 a year doing medical sales. And she's very attractive, and all medical salespeople are very attractive.
Oh, yeah, you don't get ugly medical sales.
No, but that's what they do. I mean, that just tells you right there how much money there is in our system that's not going to the right people.
And, I find those doctors disingenuous. Man, I'm not going to go off on a rant, but there was
please do.
There was a doctor who treated my dad when he came to stay with us, and had to decide, is he healthy enough to travel? Is he healthy enough to have his cataract surgery? My dad was 84 at the time, maybe 85. And, just gave him the once-over. Went to a GP. Maybe that was my mistake. But he really just didn't pay attention. And all these times we took him, had him looked at, did blood work, at no point did he ever say, hey, there's something else wrong? All this back pain. Oh, he probably pinched a nerve. He's old. No, my dad had bone cancer. But this guy never bothered to drill down on it. But yet in his waiting room was pamphlet after pamphlet after pamphlet on how to get a bigger hard-on, how to lower your cholesterol, how to be taller, how to sit there and eat sugar all day but not go into a diabetic coma, how to cure foot fungus. Every fucking thing that there's a pill for now, he had it out there. But he didn't give a good goddamn about my dad. You want to know the guy's name? Text it or find me online and I'll tell you. Because honest to God, I hate the son of a bitch.
Yeah.
I really do, because I had to sit there and I'm giving my dad pain meds that aren't touching it because he has bone cancer.
Yeah.
And this guy didn't give a shit. But you know what? He had his photo with the local football team. Mm-hmm. And boy, if they got a sprained ankle, he was all over it. And he got to sit there and put that all over his walls. And he made a healthy living.
I'm sure he did.
New office. All that brand new horse shit artwork that they put on the wall that you can buy and put in your hotel and or doctor's office. But he didn't really give a damn.
Yeah.
But he would sit there and he would prescribe you a pill for anything. He's one of the jackasses who misdiagnosed my blood disorder.
Wow. So
I fainted one time and the guy's telling me, it's like, oh, you mix your pill with dairy. Don't do that. Yeah, that's what it is. That's why, it doesn't react well with dairy.
Wow.
Never looked at my blood work to go, dude, your iron is through the roof. You have a problem.
Wow.
And how many other guys are out there? How many other people go to him for something other than, a sprained ankle?
Yep.
That are getting this, and how many other doctors are out there that like that? Because the rep comes in and promises them, hey, you sell enough, you write enough scripts for my pill of the month, and you get to go to Boca with me, and I may bang you in the hotel room.
Exactly, yeah.
God, I fucking hate those people.
Me too. I'm going to go back to an old George Carlin joke here. I love this joke. Somewhere in the world is the worst doctor. Gotta be. Somewhere out there is the worst doctor. And someone has an appointment to see him tomorrow. I mean, totally true, He's out there. Mm-hmm. And he's probably got a million different lawsuits against him, but he keeps going because he's making an ass ton of money.
He might. I think he's in Allen, Texas, but I mean,
might be, yeah.
Yeah.
In a perfect world, let's think about it. Let me ask you this question first before we get into the perfect world statement. When was the last time we cured anything?
Let's see. Other than hunger? It's been a while.
Yeah. I mean, think about it. Like AIDS came and went. There's pills for it so you can survive now.
But not
you didn't
cured.
Really cure it.
But not cured.
Nope. I mean, there's all kinds of treatments for things, but there's no cures.
Right.
Because they're keeping you on the teat. Like you said, there's probably cures for a lot of the stuff already out there, but if they cure it, then the money stops.
AIDS is money.
Yeah.
That was one of my favorite South Park episodes.
Right. I mean, if you cure these things, then at that point, the
money
spigot
goes away.
stops and the money goes away.
So then you're dealing with the fact that if the money stops, it quits incentivizing these companies to go out and make the products because you don't have somebody doing it out of the goodness of their heart for humanity because they want to make a buck off of it.
Yeah.
Nothing wrong with making a buck, but with some of these things, it's like, is that really something you should be holding over people?
So
I mean, if you were laying here dying and I know CPR, for me to sit there and look at your wife or you as you're trying to choke out words and go, hey, man, I know CPR. You got $20?
Right.
I mean, that's kind of what they're doing.
So do you think that all these cures are out there and the FDA is not approving it because they'd rather just approve these other things that are going to make them more money?
I think the FDA is too busy trying to go after cigars and hands.
True.
But I don't know. You hear all the time that there's medicines from Asia or that they're trying in other countries that are successful, but they can't get FDA approval. And people are saying, look, I get it. I'm the patient. I'm miserable and I'm dying. I will try this without your approval. And the FDA is like, yeah, you can't do that because we don't know.
Well, you got to go to Mexico to get the...
Right.
Yeah, exactly.
So I see that side of it. As far as are there actual cures that people are just like, keep that in the safe. We don't,
I got one for you.
What's
you ready?
That? Yeah.
LASIK. We would not have to wear glasses or contacts if we had LASIK. But
I think we would.
But
go ahead.
Well, we might have to wear bifocals, but how much is a pair of bifocals? You can go down to Walgreens for a couple bucks and get one. But LASIK is still not covered by insurance. That's still considered something that's optional, and you have to pay
like
money
a boob
for that.
job?
Yeah. So, I mean, LASIK at this point, it should be over the counter. It should be cheaper, a lot, basically free. Because let's be honest, without my glasses, I can't see shit. If some shit goes down, we get attacked, we're in a situation where, zombies are here or whatever. If I lose these glasses or if I run out of contacts, I'm dead. I can't see.
You'd be Burgess Meredith in Time Enough at Last.
Exactly. So, there is a cure basically for bad vision, but it's still not cheap.
See, and I would never do LASIK.
Still not covered by insurance.
Yeah. I'm going to stick with glasses.
That just pisses me off.
I just don't trust somebody putting a laser to my eye. I've watched too many James Bond movies. Like, no. That's how they were going to kill James Bond. Plus, if you look at some of the rates, they're almost like mills. It's like, I've done 80,000 LASIK surgeries, and I've been in business 10 years. Like, holy crap, how fast do you do them? Mm-hmm. So I'm just skittish about it, and I know people who've done it, and eventually their eyes, as they age, they get worse again.
Yeah, but could you would you be okay with 20, 30 years of good vision?
I don't know. I guess, let's be honest, I look smarter with my glasses. So
you could still wear fake ones.
I could.
And be
that
guy.
But I hate those guys. But, for people who really need it, I mean, I'm fortunate talking to my stepdaughter. If she doesn't have her contacts in or her eyeglasses, she's like you. She can't see a thing. I'm fortunate that my vision's not super bad, but enough where, I have two different prescriptions, one for driving, walking around, all of that, and then a specific one for reading.
Okay.
But, if I don't have them on, I can still function. It's not just the world's a blur. So I don't know. If I was in that position, I might say, hey, yeah, can you go in there and fix what's wrong?
Yep.
So, I would definitely come at it from a different position. Much like people who have terminal diseases and are willing to take a shot at it.
Yeah.
I can understand that. Hey, I'm dying. What have I got to lose?
Exactly. You extend your life a little bit or you die now. You're going to die anyway, probably in a couple of years. So what's the point, at that point?
That's true. I went on Death Clock, and that's online, so it's true. So I know the day and the time.
The time, yeah.
Yeah. So
die with a cigar in your mouth and a scotch in your hand. Well, I will. Not you. No scotch.
Yeah. Coffee. I'll have coffee.
There you go. Coffee, yeah.
Yeah. Die like I lived.
Like some KFC. You're just going to go out with KFC and coffee.
My stomach's already regretting the KFC. It feels like I just, have just oil sitting in my stomach.
More than our healthcare system is broken. But, the healthcare system definitely needs some CPR.
There you go. Well, and do we need a topic for another time. Do we need more healthcare now because of our diet and just our lifestyles?
Definitely, yeah. I definitely agree with that. Yeah, we're living the life of Riley right now. So it's a wasteland of bad food and everything else that's bad for us, and we just eat it up.
So once again, we have spent, I don't know, at least a half hour and talking about something for which
we can do nothing about.
Right. In fact, I think we might have raised more questions than we have answers.
But
that's what we do.
Yeah, we're making you aware of the situation. We're making you aware that we're not happy with it, and something needs to be done about it. If you have a way that we can maybe make some changes, or if you know someone that can help us with this issue, then definitely contact us.
You could tweet us at...
the show that's name is
Love to Hate, at Love to Hate?
Pod.
I always get those confused.
Yeah.
Or we even have a Facebook page.
We do, yeah. We do have a Facebook page.
And if you want the name of that doctor, you can find me on Facebook or Twitter through Love to Hate. Be happy to give you his info.
So funny if the doctor listens. He's like, who are you talking about?
I actually worked with somebody who went to him, and I told her the whole story, and she was like, holy crap. I'm like, yeah, good luck.
Yeah, don't go see that jackhole.
No, not at all. Yeah. So, yet another half hour of your time spent here listening to Brandon and I and Love to Hate. So, we've talked about social media where they can find us. What if they want to listen to past episodes? Or how do they track down this episode? Not that it'll do a damn bit of good, because we're telling them and we're presuming they would have already found the episode.
Yeah.
But where can they hear us?
Spreaker.
That seems simple.
It is. It's very simple. Spreaker, and they've got an app. You can download the app.
Everybody has apps. Everybody has a smartphone.
Yeah, that's
so
true.
What you're telling me is there is no reason for people all across the land to be listening to this podcast.
No, they definitely need to listen to it. Wait, there's not a reason for them to listen, or there's no reason they shouldn't?
There's no reason they shouldn't.
Yeah, exactly. Yeah.
Is that what I said?
I don't know.
Maybe this is a reason they shouldn't listen to it.
But yeah, definitely listen to us on Spreaker. Go to YouTube. We've got a page there. You can watch a video version of a blank screen and just listen to it while you're at work or whatever. Yeah. But yeah, you can definitely ingest us several different ways. Go to Facebook and like the page, and go tweet to us at Love to Hate Pod.
Awesome. That's another week, kids. Take care.
Take care.